Your plasma cells are a type of white blood cell and part of your immune system, which is your body's natural defense system. To help protect you, they make special proteins called antibodies that help you fight off certain diseases and infections. Myeloma is a type of cancer that starts in plasma cells in your bone marrow, the soft tissue inside your bones where most of your blood cells are made. This includes your red blood cells, your platelets, and cells that make other white blood cells. Cancerous plasma cells, or myeloma cells, don't act like normal plasma cells do. For one, they multiply very quickly and can grow out of control. Secondly, because they don't die off like normal cells would, they can build up in your bone marrow and crowd out the healthy cells there. Myeloma cells also don't work correctly and can't make antibodies to help protect you like your normal plasma cells would. This can weaken your immune system, making it harder for you to fight off certain diseases and infections. In addition, instead of antibodies, myeloma cells actually end up making abnormal proteins that can be harmful. When myeloma cells grow and spread throughout the bone marrow, it's called multiple myeloma. It's not known exactly what causes multiple myeloma or why some people may develop it while others don't, but there are a few factors that could affect or increase your chances. Age is the biggest one. The risk of developing multiple myeloma increases as you get older, and most people are older when they're diagnosed. Your gender is another factor. Men are more likely than women to develop myeloma. Multiple myeloma is also twice as common among Black or African American people than people of other races in the United States. And there are other factors that may increase your risk as well. These can include obesity or being overweight, having other plasma cell conditions, having a close family member who is living with multiple myeloma, and exposure to X-rays, radiation, or certain chemicals and substances. Some people who are living with multiple myeloma may have no symptoms, especially early on. But the presence of myeloma cells and the abnormal proteins they make, as well as the crowding out of your normal cells, can cause symptoms and complications, or additional problems. These can include low blood cell counts that can cause weakness, tiredness or fatigue, bleeding and bruising, and infections, bone problems that can cause pain, especially in your spine or chest, and breaks or fractures, high levels of calcium in your blood as well as nausea, a loss of appetite, constipation, belly pain, extreme thirst and confusion. Kidney problems, such as kidney damage or kidney failure, which can cause weakness, shortness of breath, itchiness, and leg swelling. And nerve problems that can lead to weakness, numbness, and a feeling of pins and needles, especially in your legs. Talking to your doctor and healthcare team about any symptoms you're having and how living with multiple myeloma impacts your daily life is important. Be sure to also let them know about your personal goals and preferences for care. Some questions you can ask them about multiple myeloma can include: how can multiple myeloma affect my body and my immune system? How can we manage any symptoms and complications that may happen? How can I make sure I have the best quality of life possible? What should I do if I feel stressed or depressed? Is there a support group or myeloma support group I can join? Where can I find more information and resources?